Mr. Kashipa.
Hello, welcome to another edition of the Young Voices Forum. It's been a while. We've been having some technical challenges, but hopefully today would have a smooth transmission. I hope that you would all also share this video so that it can get to other people for them to watch. So a year ago we were faced with COVID, and then a year later we get a vaccine. It's out that there's a lot of vaccine hesitancy among a lot of people, but regardless, some people have still gotten vaccinated. So today we have people in the studio that are going to share their experience on the effects of the COVID-19 vaccination. I have Mr. Raphael and Mr. Rashid in the studio to join me in the discussion. Good afternoon.
Yeah, good afternoon.
And welcome to Subsign TV.
Yeah, thank you. It's a good feeling to be here.
Yeah, so I hear you've taken the first dose of the COVID-19 vaccine. So what were your fears before you took the COVID-19 vaccine? Mr. Or Alaji, would you start for me?
Should I start or you want
Maybe
to
you start.
Yeah, okay, thank you very much. I think that was not a very good one because there were a lot of rumor, there were a lot of misinformation about the fact that people have taken it and they experienced blood clots. People had taken it and they became very sick, and so it was not an easy decision to take the vaccine. But as we all know, bad information or wrong information spreads faster. But I was fortunate also to hear some good information from medical experts on TV who debunked the fact that no one has taken the vaccine and come to report of impotence, because they were relating potency also to the taking of the vaccine. But I heard many people, many medical experts explain that if you don't want to experience that, don't wait until you get the disease. That because this happens only when you have the virus and they are now giving the one to treat it. That's when you experience those difficult and severe complications. So I felt that I should be among the fortunate ones who would not experience the severe complications. But it was not an easy thing. When I told my wife, for instance, that I was going to take the COVID-19 vaccine, I mean, it was like, for what? Are you sick? Okay. COVID-19 is not in our area. Why do you want to? Have you not heard about all the side effects they have mentioned about it? I said no. I said I have heard it, but I have also heard the good information about taking it. And then I was able to convince her at the end of the day, and we both came along to take the vaccination. But I will tell you that it was not an easy decision initially, even within my family, to convince them that I wanted to take it. Because before then, I even heard my mother tell the children that if they go to school and they want to give them the injection, they should say that their grandmother said they shouldn't take it.
Oh, wow.
And it was all of this were building my fears. Because you didn't know what they were hearing.
Yeah.
And the more you try to educate them about the good effects or the need to get vaccinated, the more they try to justify with what they heard. Yeah. And so when you begin to have that coming from people around you, I mean, it put fear in me, and I almost hesitated taking the jab. But I felt it was an opportunity I couldn't also miss. That's why when I got the opportunity to take it, I welcomed it.
Okay. Mr. Rao.
Yeah, as Alaji said, for me, it is the normal human nature to resist something. It's always like that. Every new thing, we resist it. I remember my fears, I had to call my doctor, and I told him I have the opportunity to take the vaccine. What are the side effects? I think he did so well by mitigating my fears. What he told me was, the evidences they've gathered today cannot be used because they are in the minority. The evidences are not enough for them to use as an evidence against the taking of the vaccine. And so when he said that particular phrase, after that, I just said, okay, I'm in for it. And so I felt very tired. I felt like my whole room was turning around. And I was like, what is this? Is it the effect of the injection, the vaccine? I was really tensed. I wanted to know what exactly was happening to me. I want to say it wasn't easy that first night. The next day when we came to work, our director had to release us to go home because we were so stressed. I mean, I eventually slept. I slept whilst I was working. I felt so tired. I think that it has some effect on our work the next day. We had to close early. By 2 o'clock, we had left the office. And
but you know, like they have often mentioned, I hold the camera on me, but like, you know, they have often mentioned the issue that what the vaccine, whenever they introduce a new,
yes,
you know, it's like a new
let's say a new element entering your body.
Entering your body.
Yeah.
And your body is also now seeing this new element and has to do something about it.
Yeah.
So I heard the medical people saying that these things you experience, like the weakness, like the headache, are a sign that your immune system is working.
Yeah.
Wow. Now, so if you take back, they also had to also say that no, it doesn't mean that your immune system is not working if you don't experience such. Otherwise, people who do not experience such side effects, maybe having the fear that their immune system is not working.
Yeah.
But like you said, I had headache.
Yes.
And the headache was a quick one. It didn't stay too long.
Okay.
Because it didn't stay too long, just around the back of my head. But it didn't stay too long. But what I experienced when I went to sleep was the heaviness in the arm that I took the jab on. It was so heavy at night, and I felt that something had happened to me. Then my fear, the fear I had before taking the jab was now coming back. Is this what they were saying? Is it going to happen? But what I was checking my potency level anytime I went to urinate. I wanted to be sure that nothing was wrong with my potency. So when I got urination, anytime I visited the washroom to urinate, it gave me hope that nothing was wrong after all. And so that was my major concern, to know that my potency was intact and nothing was happening with my potency. But we cannot take it away that it was not easy thing for us. And it was good that we had a day of around 2 p.m. to but we were all like feeling sleepy. Everyone was feeling very heavy. And I had another experience until I was staying in the office on Monday that I didn't want to let it to the job until I heard someone saying it on radio that she also had the same experience. You know, they say you could feel nausea. But I was vomiting and then I was running diarrhea. But I didn't want to relate it to you because I thought that maybe no. But I've not heard someone say this. Until yesterday I heard one lady also sharing on TV that she ran diarrhea for 2 days. But I ran it for 1 day. And then she was feeling nausea, and she took the food anytime she ate, and it really alarmed her. And that even scared, from what she said, it even scared her neighbors from going to take the jab. But from the way they saw her, they felt that no, things were not normal. But I would say that it was a good experience for me. My wife never felt anything.
Yeah.
And I
A
kept
lot of
asking
people
her.
didn't.
And I
Yeah.
kept asking her, I don't feel it. She said, no. Then I kept asking her. She not explain anything. It was after the next day.
Okay.
She told me that she's now feeling
Headache.
some headache. And
Yeah.
for her it was around the front, the forehead.
Yeah.
That she was now feeling it. Then after just some 30 minutes, she was relieved of the headache.
Okay.
You get it. But while I felt immediately, like a day before, she felt it a day after. So our individual body makeup, our system reacts to some of these things in different ways. So that's why it is not proper to generalize.
Yeah.
Because it has happened to you, then you tell others that they shouldn't do it because this will happen to them.
Yeah.
They may not have the same experience.
Yeah.
They may have a different experience based on the way their body reacts to the medicine that is introduced into their system. So I think that not to let people, not to scare people, but just to let them know that you would have some side effects, but they're not any severe side effects. There are things that just happen like the everyday you have small headache and it's gone. Except that we slept. I slept a lot. I slept a lot.
I think my experience too wasn't that different. For me, I couldn't sleep throughout the night, and there was this throbbing headache.
Yes.
And the next day, I couldn't use my left arm. I actually took the jab on my left arm. I couldn't do anything with it. I had to actually call my mom for her to send my other sister to come and take care of me.
Wow.
In the middle of the night, I actually thought I was going to pass out. My chest was really tight, and then it came with severe waist pain too. My doctor friend said I'm lying. I know what I did with my waist. It's not part of the vaccine. But I experienced severe waist pain. I think after 24 hours, everything went back to normal. And it was telling me that it means that if I had actually contracted COVID, my chances of surviving would have been very slim. Looking at the way I actually reacted to the vaccine. So it's actually a good thing that I got vaccinated, because I just took a vaccine and my chest is tight and I cannot breathe. Imagine if I had gotten COVID, how severe. So I also think that the side effects are a little price we will pay for our lives to get back to normal, because it didn't go beyond 24 hours. I mean, I think the first 24 hours is difficult, but yes, after that, everything goes back to normal. So
you remember one of our colleagues in the office, he took the thing, we all took it on the left, but he expressed it on the right.
On the right.
Wow.
Yes.
On the right. And then one other colleague in the office also said the waist, as if they had given him an injection on the right back.
Exactly. My waist really hurts too.
Yeah.
I had severe waist
pain. It was like to resist the temptation. It was not easy. But many guys I called, my colleagues, me I took paracetamol, me I took I took brufen, because the way I was feeling, I thought I needed to take something. So and I felt, should I also take? Then I was tempted, but I said no. If I take it, maybe I'm doing. It's not been prescribed for me. I'm not diagnosed. I might be abusing the medicine. So it's a very, very difficult thing not to do. To take the jab, to feel some pains, and not take some medicines to reduce the pain. It's not an easy thing to avoid. But I want to just say that, like Pastor was saying, we have different body systems. If your body cannot resist the pain, and you want to reduce the pain, and the medical person tells you that it's okay, why not?
Yeah, I think even during the jab, the nurse that was doing the jab mentioned that you could take a painkiller if it was too severe for you. I remember her saying that.
But if I had heard this other information you mentioned, like take it before,
yes,
I would have blown it out of proportion. Many of us colleagues would have been tempted to do that.
Take it
because that fear we had before taking it.
Yeah.
You know the way we had to convince people to come and take it.
In fact,
Yeah.
People were very, very resistant.
Yeah.
They just didn't want to step into the conference room where the jab was being taken.
Yeah.
But I was also amazed that there were others who were very willing.
Yeah.
It's about protecting your life.
Yes.
And I like what you said about staying alive.
Yeah.
The pain of staying alive.
Yeah. I mean, the side effects are very little price for us to pay for our lives to go back to
It's a little
normal.
price, yeah.
I mean,
for us to pay for life to
because
go back to normal.
personally, I am tired of wearing again.
Yeah.
Again.
Taking the vaccine does not mean that you are protected against. It is not a cure for the virus.
Yeah.
And
That's
so
what was
please,
mentioned.
we still have to be wearing the
A mask.
nose mask.
Yeah.
As for the nose masks, the last time they made some profound research findings, and Dr. Dia was one time one of the doctors in King's Medical Center, Dr. Dia.
It's a short one.
The short one.
Okay.
He is now a deputy chief executive.
At the CHAC level.
Very good at the
Yes,
CHAC
yes,
level.
yes, yes.
He was saying that the hygiene we have practiced recently because of COVID, that hygiene has lowered the cases of
even normal
diarrhea, all that. Normal sickness, it has lowered everything. So COVID-19 was a necessary evil. Yes.
I think it's taught us a lot of lessons, apart from looking at how inadequately resource our health centers are. It has also taught us the need to keep ourselves clean all the time. So maybe there is an upside to it. I mean,
you know, if you look at what we are doing now under COVID-19 to wash our hands regularly, it's a practice that was already encouraged.
Yes.
But how many of us took it very
seriously?
See, to wash your hands after handling things or after shaking people, it was things that were encouraged. But how many of us took that serious? So,
we didn't.
So for me, I feel that it's important that you have reminded us that the fact that we have taken the jab does not mean that we are immune from getting COVID-19 or even infecting others if we have it. I'm happy that you have reminded us and our followers about this. But what I just want to tell young people who are listening to us and adults like me is that we need to take advantage of the virus, the vaccines, to protect our lives.
That's it.
There are still many people who will not take the vaccine, even today when you give them the opportunity to do it. When I heard in the news yesterday that about 2,000 vaccines in Ghana were going to be destroyed.
In the northern region, that's
2,000 in the northern region, not Ghana.
In the northern region.
2,000 in the northern region.
That expired today.
You can imagine that is expiring and has to be destroyed. And then so I wonder, how is this happening?
Okay, I think one thing too that I want to know, you know, there was a lot of misinformation in the system. Do you think that the government did a good job to counter all of these misinformations before the vaccine rollout was done?
For me, no.
Okay.
I don't think we did a lot of education. I don't think so. It looks like the wrong information was spreading more and faster than the real information.
I agree with you.
I was thinking that
I have a different
NCC
opinion.
supposed to do this on the road campaign, making this, you know, they go to the...
One is health related, it's purely Ghana Health Service.
It's purely Ghana Health Service. Maybe in collaboration.
Public health promotion.
They could go to the community to talk to them. Because the bad news spread so much that people were in fear instead of coming for the vaccine. And the only way to make somebody respond to the vaccine is for the person to be distich. what the person now know. You have to now return it around.
Yeah.
Teaching is one of the best things that turn people around. And so they have heard that it gives them impotency.
Yeah.
They cannot, the women become infertile and all that. We have to preach another message to them, which we fail to do.
Yes.
And so the wrong information is out there, and they have accepted it, and that is why they will not go for the injection.
I have a different opinion. I think that a lot was done to inform the general public about the vaccination.
A lot?
A lot
Can you point me to a few that was done?
You know, we had a lot of TV series, even there were some like cartoons encouraging the general public that
Why?
On TV, I've seen even people saying that the Ghana Health Service had a lot of sessions where they tried to debunk their fears. They tried to educate the public that, look, take the jab. Where I think the challenge came, and we have to now destroy some of this, was the fact that they said this one was for the frontline workers. You remember?
Yeah.
They said this one was for frontline workers. So, like Ghanaians, me and you, we didn't psych our mind that it was our time to take it.
Yeah.
We felt that no, they said it was only for health workers. And you remember some of us were making the noise there, but what about those of us who are on a daily basis working with the health workers on the field? Like the way we got the opportunity to get it, because we are working with them on a daily basis on the field, so there was the need for us to also get vaccinated. But you see, a lot of people, there were many who would ask me, how can I get the thing? I didn't know how to get it. But they are not where, they are not frontline workers.
Yeah.
And there was no information, that I agree. Like at the regional level, there was no information out there to inform the general public that whoever was interested could walk to ABCD locations and get vaccinated. I'm telling you that if that information had gone out at the regional level, that I agree, that there was very little information at regional levels to inform people that, okay, we have finished vaccinating our health staff. So whoever is interested should come. So then they do it like on a first come, first served basis. When the vaccines are exhausted, then they end it there. But this information didn't come out from the Ghana Health Service to the general population that, okay, we have finished vaccinating our health staff, and we still have so much left, so you can come and vaccinate. You know, I don't know if you have not come across people who are saying that I wanted to take it, but
I didn't know where.
A lot of people. And you see, Alaji, when you watch Joy News, at the end of the news, they give you places where the vaccine can be taken.
In Accra.
Have you seen anything like that?
That's what I'm saying. So that's what I'm saying, that for that,
there's nothing in the I for one didn't even know that they were done with frontline workers, and then they were actually doing the general public.
Never informed.
Because when I posted about taking my vaccine, people kept asking me, is it now open to the public? And I said, I have no idea.
That's chilling.
Yeah.
So what we benefited from was the one for the health staff, frontline workers. So that's what I'm saying that. That's what I'm saying that. At the national level, before the vaccination, there was enough information to debunk the fears.
No.
You get it? But the only reason why we are having to destroy some vaccines because of the spike is because the general population thought that they were doing it for, and you know, they were also, for the other people, they were also capped. People with severe underlying health conditions. So if you didn't have the underlying health condition, it means that you are not qualified. For instance, I have peptic ulcer, and they say that's one of the underlying conditions. So if I go, even if I went to the vaccination center and I proved that I had this condition, I was going to be vaccinated. But what about you, who needs it but you don't have an underlying condition? So people who didn't have any of these underlying conditions didn't see the need to put themselves forward for the vaccination. And to make matters worse, you know, some of the misconceptions that came out were tied to the religion. Didn't you hear? There was who were saying that they added pork fat
Yeah.
And you Muslims,
I didn't hear that.
And Muslims,
we don't take pork.
Yeah.
So the moment they say that, in the northern you know what will happen. So you see, so like you are saying, but I heard on one of the Friday prayers, one medical doctor asked for an opportunity to debunk those fears, that all that they were saying were wrong. And he took his time to explain that for every vaccine that is created, it's used for A, B, C, D, D, D. And even among the medical, the scientists who are doing this are people from all religions.
So can we say that in northern region they did us wrong? Because in Accra and Kumasi, you know, there was a time I was questioning. I'm like, you say you're vaccinating frontline workers, and then I saw celebrities also being vaccinated, and I understood that this was all done in the bid to encourage people that the vaccine is safe.
Yes.
But northern region, did anything of that sort happen? In Accra, I know pastors, big pastors who are behind mega churches were vaccinated to prove to, you know, those that have large following. But northern region, I didn't see anything of that sort. I thought like maybe they would have where Pans Ghana and Co will be vaccinated or talk to the imams.
Happened, but because it was not at the national level, the TV, it wasn't covered. It wasn't giving any visibility.
Alhaji,
yes,
like we are saying, there was either no communication or less,
or very little communication. Yes,
communication.
I agree with Mr. Rao.
Very little communication, and the issue was they were specific for frontline
workers.
Yes.
And so
I'm not a frontline worker.
Yeah, because you should see posters, you should hear radio adverts, even in the local dialect, trying to tell them that this thing is safe. Have you heard anything? Have we heard anything? Nothing.
No.
And so I think that there is
we give opportunity to the Ghana Health Service.
very little
there was someone here
on this particular
there was a medical doctor here to educate our followers that.
I mean, we at Subsign TV, we did our bit, which I want to really applaud the team for. But we went through great lengths to get someone to come and educate people that, so I can say that people that follow our platform had that form of education. But we can also tell how limited that is.
Anyway, no, it's true. There was very little, especially in the local dialect. And even now, as you said, you have very little information still in the local dialect. Just encourage people that look, what the things you are hearing, they are not true. Unless a doctor has an opportunity to be on TV, you don't hear. And I don't know, but sometimes I also have a challenge, and I blame our media houses. Like the way we took the pain to bring someone to do that education. The media houses, they always expect NGOs to come and pay.
I think they should have offered slots for people to come and do education.
Just to go and tell Ghana Health Service that we want you to do under 2 minutes or under 3 minutes jingle to say ABCD, so that we can play it on our to educate the Ghana public on ABCD. I mean, corporate social responsibility, but we don't see this coming. So, so I don't want, the blame should be on both government, the Ghana Health Service, and even the partners. Partners like the media houses, who could give their spaces for this kind of education to happen, but they did not see the need to do that. And that's why I tell you that that's where our local champions, our musicians and movie actors feel themselves. In down south, you saw some of them joining the campaign to work to Ghana Health Service to say that, okay, so I've realized that you are doing this. I feel that as a citizen who is popular and have a lot of following, I want to do this to be able to encourage my followers or the general public to do this. I mean, it's our responsibility to our motherland. You get it, but it doesn't also take anything away from the Ghana Health Service and on the other stakeholders thinking through and saying that no, let's go and approach ABCD and get them to vaccinate. Now, I'll tell you another thing. If they got them vaccinated, how was it going to come to our notice?
We'll showcase it on our local televisions.
So they are inviting the local television, and the one who is coming to cover it, one Sole. You see, like sometimes you didn't take Sole for producing that too. But the one who is coming to the Ghana Health Service to cover it is already looking for Sole. So how would that happen? If you don't get Sole, the thing is not coming.
And then
the one who's coming from the radio to come by. This is looking for
and then I also realized that the celebrities, they use social media a lot, from Twitter to Instagram.
Yeah.
People actually filmed themselves taking the vaccine.
Have you seen that opinion of
but I don't think that actually happened in Northern Region. I was really looking forward to also using our celebrities here to also you know, join the cause, but I didn't see anything of that. So I don't know if maybe they offered and they didn't get, or maybe, but regardless, I think that a poor job was done in the Northern Region.
Let's give these celebrities the benefit of the doubt. Alaji said it's maybe pride, but I want to say it might not be.
Yeah,
It's just that there was nothing, there was no education, there was no bringing them to the forefront.
But you know, they also have them launched songs on COVID-19.
They did.
Yes, I think Fancy has a song on.
Otherwise, we help out with the information. 70% of them had songs, especially the popular musicians.
So that's why the more reason why Ghana Health Service should have reached out to them. You could have even used some of their songs as a campaign campaign song to move around and educate the general public.
You see, the challenge, like I mentioned, and like we mentioned, that it didn't come enough to educate the general public about the misconceptions of taking the jab. It's still the same challenge we had with the information about the availability of the jab to the general public. Yeah. Do you get it? We spend, you know, when you don't value the communication, this is what happens.
That is it.
You know, communication is very, very key in health promotion. Do you get it? So, but many of us do not see the need for that. We just feel that we need to just carry the thing into the community, and once we are there, people will come. I remember those days, the government biter will go around and say that tomorrow morning, they are asking every mother with a child of this age to gather at the chief palace for ABC. That was communication then, and it was effective. Now we have all the radio stations, we have all the TV stations, but the social media, but we are doing poor communication.
Alaji, it's not true. When they were going to vaccinate our children for polio, there were this announcement on radio.
Yes.
There were jingles on radio.
You know,
guns were moving.
You know who paid? The thing is, someone was paying for it.
I know someone is paying for it. But you see, there were actions. But this, our inaction in this particular,
I wish we did not have to report that we're destroying vaccine, because I know a voluntary worked to take the vaccine if they knew. There's an opportunity also for us to see what we can do next time with the Ghana Health Service, maybe our platform, the subsidy platform, what you can do next time. Maybe, because sometimes you are thinking that they are doing it and they are not doing it. Maybe next time we could look at how we would engage the Ghana Health Service more, especially when now that Ghana is receiving more of the vaccines to vaccinate the general public. We can see how we can partner with the Ghana Health Service more, use the platform to give information, especially to our young colleagues.
And also urge them to do a better communication.
Yes, no, our young colleagues, if they can, we have the cameras, if they can make themselves available to say that we would, to say what they have to say to the general public, we can pick it, put it on our platform, please. Intermittently we can break to play some of those things and then continue. So I think that we are available as a platform to support them when they want to, because we want every young person who is following us to be safe.
Yes.
Because the other number says that they are the majority.
That's the thing.
So we cannot reach them. You heard that now in the US, it started, the numbers among the young generation because of COVID has started rising. We do not want to sit down to have that happen among our young people in Ghana before we start, and we don't have any resources yet already. So we cannot risk having to wait until and do firefighting when our young generation begin to be affected by COVID. So I think that we would also have to look at what we can do when the next baggages come into the country, and everyone is now given the opportunity to take the vaccine. Because for me, I feel that it's a responsibility for all. We all have to play our part to ensure that the country is safe for us to live in. We have taken the jab, and we are now waiting for the next jab to take it again. It will be sad if the young people we have to work for, we are safe and they are not around for us to serve. So that's why I'm urging everyone who is watching us that the moment you have the opportunity to take the jab, please do not hesitate. Do your best and take it. We have taken it, the three of us all, and our crew who are behind the cameras have also taken it, and no one has suffered any complications that has resulted in admissions at the hospital. And I have a wife, and I'm still doing my matrimonial duties. My team is still functioning, and I'm still fit. I seem to have more energy now even than before.
I don't know how you understand potency and then impotency. But it's not only the functioning of the
they said the thing will not sorry. Sorry, cry. They said do not erect.
Thank you.
They said election will not happen. Now the election is happening. Once the election is happening, it is still the way it was before I went to take the vaccine.
Thank you.
So that's I'm not going to debate about saying is that I had the fear that I could not be experience election anymore. But I'm saying that it's become more stronger after taking the injections than it was before. So I'm just saying that anyone who has the opportunity to take it should do well to take it. It's an opportunity economies. Yes.
The studios have become very interesting. Alaji is really saying something, and I think that you are listening. Maybe this would ginger you to go and take the vaccine. So if you just joined us, this is the Young Voices Forum, and today we are having a conversation about the side effects of the vaccine. I have with me Mr. Raphael and Mr. Rashid in the studio, and they are sharing their experience about taking the COVID vaccine. So if you are watching, you can also leave your questions or comments in the comment section, and also share this video so other people can have access to this education. So still on the side effects, Sarah, how long did your side effects last?
I think that mine, it was Friday and Saturday, so 2 days, 48 hours.
Okay.
It was 48 hours. I think Sunday when I woke up, I was relieved. So it was, but I was still having that pain
in your arm.
In the arm.
Yes.
Yeah, that one lasted. But all the other headache, the stress and all that, it was done. It was gone by Saturday night.
Sunday it took quite a while because when I took it, we were made to go home on Friday, and Saturday I experienced it. Unfortunately, on Sunday, I drove out of town, so I didn't, fatigue to my system. So at night, I had some headache again, but I associated that headache to the driving I did to the village. Because it was quite a long journey, and I drove in and out by myself, and I felt that I shouldn't have made that journey. So on Monday, it made me come to work still looking tired and exhausted because I had not given myself enough rest. So it's difficult for me to tell when it actually ended. I would say that I got to leave on Tuesday.
Okay.
Like about 3 days after from the Friday, Saturday, Sunday, Monday. It was Tuesday I got to leave, and I now sat in the office, and I wasn't dozing. I didn't feel dizzy. I felt okay. And so for me, I think that it was barely the side effects.
Okay. Yeah, I heard that for other people it takes a while before.
Yes, she's not experiencing the side effects. She's feeling she's having malaria. From the day of yesterday. She's thinking she has malaria, and I said no, you should just give it some time to see if it's not the reactions from the vaccine, and then we can, before she goes to hospital. So I'm really, it's really very, very technical to tell how the vaccine effects would be on an individual level.
Yeah.
Because it's almost like after a week, and she's now experiencing.
So my doctor friend told me that for people that reacted very badly to the vaccine, they realized that they had malaria. Oh yeah, that's what he told me. Yeah, so when I called to complain the he told me that, if he was aware, he would have come to take my sample, because back at their place when they vaccinated, he said some people reacted terribly, and when they took their blood sample, they realized that they already had the malaria parasite. Maybe it hadn't actually developed into so it made them react it made them react very badly. So I think that maybe probably if you are about to get malaria and you take this vaccine, you might really react. So I think that your wife should go to the hospital to also test for malaria and then probably just treat it along, because it's important, because that's what my doctor friend told me.
So, one thing I feel we are not doing right is the generalization of the side effects. Why can't we have Ghanaian scientists do a research on those who have taken it, and then you can give us a specific side effects? We are saying blood clots. We are saying other things,
but it hasn't happened in Ghana.
It has not happened in Ghana.
And I think a lot of people are dwelling on that, not to take.
We've taken about 700,000 people. So why don't you do a research? And then tell us that, for Ghanaians, because of our climate, because of the environment, this and that happens to those who take it. And then you allay people's fears.
Exactly.
We are rather listening to what
the Western people. It's not the same. Our people, our systems are very different. I agree.
Let us always say that the colonial mentality, we are independent, but we are still colonized in our minds. You get it? So, and the Dr. Ajimabila Costa was saying that he cannot understand why countries like are already coming out with their own vaccines. And with all the expertise we have in Ghana, that was the day he took his vaccine and he was being interviewed. And he cannot imagine that already we have not had Ghanaians coming out with sample vaccines that would have been undergoing trials now. What we are already experiencing are those from the medical practitioners. And because we do not have so much trust on them, because most of them are not scientific, they are just saying it, and when you take it to the laboratory, it doesn't work when they say it. So because of that, we are having challenges having to believe them. But we had a lot of the traditional medical practitioners.
You pay attention to them and test them. That's what.
But you see, their challenge is that they are not developing vaccines; they are developing medicines. And a virus is not cured with medicine. And it doesn't take. It's not cured with something that is taken in the mouth. It's cured with a vaccine. So that's the challenge we have with them. So, but they are not developing vaccines; they are developing medicines.
Developing medicine.
And also, like you were saying, I feel that by now we should have had one or two vaccines kind of from one of our universities.
Not even a vaccine. Do an assessment on.
No, and I get what you say. See, what would be our side effect?
And so we can put that one out there from outside.
And we
are rather getting a lot of data from outside. The current one is Johnson & Johnson. Their vaccine is also said to have a rare blood clot, and so they stopped using it. We hear this outside. What about internally? When we are informed, it is easier to move on.
So for instance, has any Ghanaian over 60 years experienced the blood clots after taking as seen outside the country? All of those things.
We are not hearing anything.
We are not.
We are not hearing anything, and it looks like
we have to take the camera to the street.
We have
to take the camera to the, so the production crew may have to take the camera to the street to
do a research.
A research and investigation.
And he will have no one validating such a research for you.
But we'll still try. So I'll just take, we have come to almost, we have just a few minutes to go, so I'll take final words and then we wrap up. Mr. Raphael.
I think that, yes, there is a lot of myth about the vaccine. It is better to stay alive than to go through the crucial moment of suffering from the virus. You out there, all you need to do is to take the vaccine. I don't know if it is still available in the northern region. All I need to tell you is that take the vaccine. There is so much conspiracy theory about the vaccine. We don't have evidence. And for the fact that we don't have evidence, we cannot put anything on paper. Just take the vaccine and stay alive. For
my colleagues, young people, my colleagues, young people, that when they have, that I'm urging them, they are the future of our nation, so we cannot risk to lose them. I just want to urge them and to call on them to take the advantage to vaccinate, to take the vaccine anytime they have the opportunity, because it's better. They say it's better to stay alive than to struggle for your life at the hospital.
Yeah.
So let's take precautions. They say prevention is better than cure. Yeah. But in Africa, we always want to wait until it gets worse, then we cure. So I just want to urge them to take that statement serious. Prevention is better than cure. And we have taken a lot of vaccines going up, and we're doing that.
Yes.
So this one too will not kill us. Yes, thank you very much.
Okay, so thank you very much, Mr. Rashid and Mr. Raphael, for taking time off your busy schedules and making it to the studio today. You've heard them, and I also think that anytime you get the opportunity to take the vaccine, please do not hesitate. Trust me, the side effects are there, but we are all different people and we all react differently. So maybe it took 48 hours for me to get back to normal. For some people,